Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call.
Hi, everybody. Welcome to Healing Families Shattered by Addiction. This is Dr. Brian Jackson, and I'm here today to talk to you about a topic that is really sometimes overlooked or not paid that much attention to, and that has to do with the person who is going through detox and recovery and hopefully some inpatient stay, and some of the things that may occur afterwards, after they've completed their sobriety or not sobriety, but completed their treatment, and now they're back at home and trying to get back into the stream of life. And so I think it's real important that we talk about what's called post-acute withdrawal symptoms. And post-acute withdrawal symptoms are something that are very common. They happen after people go through treatment, and it can be something that's quite disturbing to some people, because it's like, what's up with this? Because I've quit drinking or drugging or whatever it was, and why am I feeling these feelings that kind of mimic some of the feelings that I had when I was using or when I would attempt to stop using. So I think it's important that the person who's in early recovery, but also the family members, know about this and can recognize some of the signs and symptoms and understand that this is normal. So, the question is, when does post-acute withdrawal syndrome occur? So often the symptoms are triggered by stress, or brought on by situations involving people, places, and things that remind the individual of using. So we talk about that a lot. That in early recovery, you really need to try and avoid the people, places, and things where you used to participate in alcohol or drug use, because that can trigger the brain to think about using again. So many people in recovery describe the symptoms of PAWS, which is our acronym for post-acute withdrawal symptoms, as the ebbing and flowing like a wave, or having like an up and down roller coaster effect. So in the early phases of abstinence from substances, symptoms can change by the minute as individuals move into long-term recovery from substance use disorders. The symptoms occur less and less frequently. So um, the frequency and intensity of these symptoms will dissipate over time, but it's important to be patient and understand that there's nothing wrong with you, that you are not unique in terms of some of these symptoms that you might be experiencing, which are very common for anybody that's early in recovery. So let's talk about that. Let's talk about what are the most common symptoms of PAWS, post-acute withdrawal symptom. It's easy for me just to shorten it up and do PAWS, but in order to like minimize the risk of relapse, this is what we're trying to do. So knowledge is power, right? So if we know that this is a possibility in terms of something that we may experience after we've stopped using, um, that many of these unpleasant and uncomfortable sensations and feelings that you experience in early recovery could be symptoms of PAWS. So it's important to understand that PAWS symptoms are temporary, okay? So they don't last. And sometimes when they come on you, it's like, oh my goodness, how long is this going to last? Or is this going to last forever? Because it's very, very uncomfortable. So I wanted to give you a list of some of the most common symptoms of post-acute withdrawal symptoms. Um, and it can be foggy thinking, and trouble with memory. A lot of times our short-term memories are impacted uh, by our usage. But the good news is, as long as we abstain and stay in recovery, that our short-term memory will come back, and it will come back fairly quickly. Another sign is urges and cravings. And there are different things that can that can trigger these urges and cravings, but in particular, people, places, and things. It's just so important that we try to avoid those situations as much as we possibly can. I mean, obviously, there'll be obligatory events that you have to go to where there might be alcohol served, i.e., a wedding or christening or something like that. But in terms of selecting places that you want to go and people you want to be around where it's not obligatory, I highly advise that you make the choice to protect yourself, protect your sobriety, and protect yourself from these urges and cravings. You can become irritable. You can even become hostile. Um, there may be sleep disturbances, um, and that can include like vivid dreams. There could be dreams of using or drinking. And that is very common in early recovery because it's the subconscious mind asking the conscious mind, like, where is the alcohol? Where are the drugs? So, again, these are all temporary, but it's very important to know that they exist, and it's very common. Fatigue is another one. Your body's trying to reset, reprogram your brain, your organs, and it takes a little bit of time, for that energy to come back. Sometimes there's issues with like fine motor coordination, um, but again, that is temporary. A lot of sensitivity to stress. So if you think about how maybe we used alcohol or drugs to cope with stress. So now we have removed the coping mechanism, which was an unhealthy coping mechanism. Now we are, as you would say, stark raving sober and dealing with stressors in our life. And we're trying to learn new healthy tools to be able to deal with this stress and not freak out, because you're feeling stressed. And that can translate into anxiety and or panic. So these are all things that need to be worked on. We talk about dual diagnosis, that the drinking or the drugging was but a symptom of something else. So these underlying issues, the anxiety, the depression, fatigue, lack of initiative, um, or even the inability to focus, are all things that you can work on with a therapist, or especially when you're having mood swings, we want to try and get you leveled out. But the other important message to family members is that this is common and it's not your loved one choosing to act out or choosing to be stressed, that these are things in time with counseling or having accountability partners who are also sober, going to meetings, things of that nature. It can reduce, the impact that it has on us in terms of stress. So the next question, and I get this a lot, is can post-acute withdrawal symptom be avoided? Well, while avoidance of post-acute withdrawal syndrome isn't possible, you can definitely manage your symptoms, by learning successfully manage post-acute and secure and acute withdrawal symptoms. You'll feel better physically and emotionally, and you'll improve your self-esteem and reduce the risk of relapse. So, and again, that's by learning to successfully manage those post-acute symptoms. And that could be through exercise, proper eating, trying to get sleep, finding a therapist, going to AA or NA, whichever you prefer. And then you'll find out in those meetings that you're not alone in this. And again, the frequency and intensity of this will dissipate over time. People ask me, how long do PAWS symptoms usually last? Some symptoms can last for a few days at a time, although this is dependent on the type of alcohol or drug addiction and the amount and frequency of substance use. So every person's withdrawal pattern is a little bit different. Typically the brain recalibration process takes anywhere from 6 months to 2 years before the brain once again naturally produces endorphins and dopamine. So some people hear that and they go, oh my goodness, 6 months, 2 years before I'm back to normal. Well, it's incremental. So again, the brain is resetting, the dopamine depletion that we've done, the endorphins that have been depleted as a result of the use of alcohol and drugs, is getting back into homeostasis, if you will, or back to normalcy. So it's easy to say, you need to learn how to manage these. So I wanted to give you some coping strategies for getting through the post-acute withdrawal symptoms. So I'm going to give you 10 practical tips for successfully managing the symptoms of post-acute withdrawal syndrome. Number one, make an appointment with a mental health professional for both psychiatric and psychological care. And the reason I say psychiatric and psychological care, because if there is chronic depression or anxiety that might be there that needs to be treated with an antidepressant or a non-addictive anti-anxiety medication, sometimes medication-assisted treatment in tandem, with talking to a psychologist or a licensed clinical social worker for cognitive behavioral therapy in tandem with medication-assisted treatment is very, very effective. The next one is be good to yourself. So you got to practice self-care by eating well. We talked about that before, exercising, avoiding trigger situations when possible, and you want to establish, positive, supportive relationships. A lot of the relationships we had before we were using, we thought that these people were our quote unquote friends. We stopped using and they kind of not supportive because they're continuing to use. And then you realize very quickly who your friends are and maybe that these people were just acquaintances. So it's important to talk about what you're experiencing with your 12-step peers. And when I say 12-step peers, I'm talking about AA, NA, Celebrate Recovery, whichever one you prefer. It's very important to get a sponsor, which I like to refer to as an accountability partner, who will really get to know you so you can be rigorously honest with another human being. A counselor or therapist or family, anyone who will not criticize or minimize your experiences, because these are real, okay? But again, I can't emphasize enough that they will dissipate over time. So, you might want to review the events that precede a flare-up of your PAWS symptoms and think about how you reacted. So,
If you know what to expect, you won't be caught off guard the next time the situation arises. So when it happens, instead of like when it first happens, we might freak out and go, "Oh God, what is this?" But now that you have the knowledge that it can happen, you acknowledge that, okay, here it comes, I'm a little stressed out, but this is all part of it. It takes the punch out of it. That doesn't mean you're not stressed, but we want to tap it down, manage it so that you can function and not freak out. So it'd be important too to start a journal to document your experiences and identify, you know, alternative ways of responding. So you have this feeling of anxiety. Where did it come from? Write it down. Is it true? Is it not true? Is it partially true? Um, so it doesn't take a lot of time in real time to write down what you're feeling or what you're thinking. And then, you can go through that, with somebody. So if you're having a hard time concentrating, limit the amount of time you spend on any one task, no more than 15 minutes. Another coping mechanism is to interrupt the circular thinking cycle by doing something different. Talk to a friend, listen to music, go for a walk. We talk a lot about move a muscle, change a thought. So when you get stuck in this ruminating thinking, sometimes it's almost paralyzing. So you need to force yourself to get up and do something else. And I assure you that will diminish, this obsessive thinking and its effect on you. So if you have problems with memory, write things down or set up reminders on your phone. I do this all the time, but that's probably because I'm old, but it makes life a lot easier to get it out of your head and get it down on paper. So it's another thing that's not, bouncing around your head that you have to, think about. It's written down. You can check it off as you get it done. So if insomnia is a problem, you might want to limit the amount of caffeine, used before bedtime, and try and establish a sleep routine by going to bed at the same time every night and waking up at the same time each morning. So, this will help your sleep rhythm. Because if you're inconsistent in your sleep patterns, like when you go to bed, some nights you stay up late, other nights, you go to bed early and you're rolling around. So, if bedtime is 10 and you're getting up at 7 or 8, that would be, that would be ideal. Whatever the numbers are for you. Some people need 8 hours sleep, some need 9, some need 10, some people only need 6. And so the last one is that you need to be realistic. You can't hurry recovery. You're going to have some bad days, yes, but try to remember this too shall pass. The symptoms are part of your recovery journey and proof that you're making progress. So again, patience, trusting that these things that I'm telling you or that you're reading about are true. You're not terminally unique. And it's just real important to understand that this is part of the recovery process. So I really wanted to get that topic out to you today and to the families, and to not get discouraged, either the recovering person or the family, if you see some of these signs and symptoms. But, for whatever the problems are, there's always a solution. So I think it's important to, work through these things, and it's going to give you more a feeling of relief and satisfaction that you can, in fact, manage these signs and symptoms of post-acute withdrawal symptoms. So that's all I have for today. I hope this was helpful. And I look forward to getting with you guys on the next podcast. I don't know if it'll be myself or Di or me and Di, but if you have any questions for us, you have our email, which is info@familyandaddictionexperts.com. We also have a family survival kit on our website, that's free to download some PDFs. And then, of course, we have our podcasts, which are on Spotify and iTunes and YouTube. I can't remember them all, but anyway. All right, everybody. We will see you or talk to you soon. Thank you very much. Bye-bye.
Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.